Welcome to Kick It Up a Notch, hosted by Megan and Jenny. We're here to bring you lively conversations, inspiring stories, and a little bit of everything in between. Whether it's life, business, or just a good laugh, we're turning up the energy and diving into what makes life extraordinary. Let's kick it up a notch. Welcome to another episode of Kick It Up a Notch. I'm Megan Thomas, and I am here with my amazing co-host, Jenny McBride. We are realtors, entrepreneurs, and all-around pretty fun gals. We're so glad to have you back for another episode of Kick It Up a Notch. Make sure you check out our last episodes, follow, like, and subscribe.
Yes, we are so glad to have you back. We are here to talk with some incredible people who are making a real difference in our community. Whether it's through their businesses, nonprofits, or innovative ideas, these individuals are shaping the future in ways that often go unnoticed. We wanted to create a platform to share their stories and celebrate their impact. So today we're kicking it up a notch with Jessica Blandford. Jessica is a nurse practitioner at Optimize You, a hormone clinic located off of Highway 41 inside Lawman Tactical. Jessica has experience in hormone optimization, pain management, and family practice. She has been in the nursing field for over 10 years. Jessica is passionate for health and wellness and wants to help empower patients to have the knowledge to make their lifestyle changes and to be in better health.
Optimize You are locally owned clinics that are all run by licensed and trained healthcare professionals who are passionate in making a difference in your life. They pride themselves on continuously educating all of their practitioners to be up to date on all of the latest information to ensure optimal health. Optimize You can help you feel better physically, mentally, and sexually. Normal is not optimal. Thank you so much for being here today, Jessica.
Yeah, thanks for having me. I love the intro, you guys.
Yes, thank you.
Yeah, we were. So one of the reasons why I wanted you on here is because about 6 to 9 months ago, I started going to Optimize You, and it has really changed my life. And whatever the reasons were for that, one of the reasons is that I had started working out, and I'm getting close to 50, and I just wasn't seeing any results. I was working out hard. I also have had a full hysterectomy and was not on hormones at all. And so it has just really changed my life going there. And so I wanted to bring you on to kind of, so you could talk to people a little bit more, and maybe other people could have some life-changing experiences as well.
Yeah, definitely. Very common symptoms, that people experience coming in, and some people don't realize that it's hormone related at all, or they've been trying to get answers, and then they're finally coming into a clinic that realizes that, yes, normal's not optimal. We're not making that up when we say that. We don't just put people into that standard, like, let's look at your labs, not listen to the patient at all, because definitely labs can be normal, but we don't feel anything but normal. I love hearing when people are like, I feel so much better. It makes it so much like just a better experience. I love all of my clients, amazing people doing amazing things, and just making their like overall quality of life so much better. So I'm so happy to hear that. So
yeah, it's been great.
I can't believe it's been that long, Jenny.
Yeah,
6 to 9 months. So Jessica, what inspired you to specialize in hormone health?
Yeah, so I have personally dealt with hormone issues my entire life. From like the moment I started my periods, they were not normal. And because I wasn't in an age where I wanted to try to get pregnant, that I just really got like blown off. I was put on like the standard, well, here's birth control. Well, it would stop working. They would try another one until that stopped working. And I just was all over the place. I went like years without periods, which is not healthy at all. And again, they told me, well, and I was like, should I be concerned about a family in the future? Things like that. And they were like, well, you're not at that point, so we'll talk about it then. Okay. So I just kind of like took charge myself. Definitely in nursing school, it's still, you don't learn anything about that. You learn like, these are symptoms, give this medication. And then whenever I started like traveling, I met other functional health providers that looked into things more than just like the standard, let me look at your like CBC, CMP. And then once I became a provider, just healing myself naturally and like looking into that, doing the extra education, because you don't learn that. That's not something that is gone over whenever we're in school. It's like briefly talked about, like you have to specialize and go into that extra education for it. So that's really what drove mine, is that I didn't have anyone here to help me. I had to go other states to get help. And it was just really frustrating. I was just put in like a standard because I wasn't like overweight and I didn't have like the typical symptoms. They just ignored me.
Mm-hmm. So what is the common misconception people have about hormone therapy? And it may be different for men and women. So, if you could talk about that a little bit.
Yeah, I think one of the biggest misconceptions that I get is that it's bad for you, that it's going to like increase risk of like cancers. And then also you get the other where people have abused it, and then they see people that have abused it and like the poor health that they've been in because of that. Those are the standards, but like with like the cancer risk, because I get that a lot, that was with synthetics. They're derived from animals that don't mimic our body's production of hormones, derived from urine of animals. Like, of course, that's not going to be good for humans. It doesn't mimic anything we do. When you look at bioidentical hormones that are plant derived, they mimic our body's production of our natural hormones. You don't have that risk. It would be, yes, if people have genetic factors for certain things, that's completely opposite, because their own hormone in those levels could cause that. But if you don't have that like genetic factor, there's no risk in it. There's just benefits with hormones. They decrease heart disease by reducing like your overall cholesterol, increasing your good cholesterol. It helps with your energy levels, so people continue to work out and stay healthy, keep that lean muscle mass. Insulin and like glucose regulation, so you're preventing like type 2 diabetes. You're not getting osteoporosis, so you're not fracturing things. It can keep people off of a lot of medication. Mood, a lot of people will be depressed and anxious. Well, and then you improve things, and then they're not on antidepressants. So there's a lot of benefits. I think that's just where it's been skewed, is that it's all about risk of cancer and that this is going to harm me, and people they just run away from that.
Let's go back a few steps. So I guess, what is hormone therapy? Like, can you just give an example of some hormones, I guess?
Yeah. So with hormone therapy, so in different stages of life, there can be with like younger people with like PMS, PMDD, or there can be perimenopause, menopause, and then men. Okay. So you're thinking females, you're thinking estrogen, you're thinking progesterone, you're thinking testosterone. And then men, you're purely thinking testosterone, but when you increase the testosterone in a male, you're getting that increase in estrogen too. And then there's different forms. There's so many different forms. We personally only utilize, like with testosterone, we do injection or cream of that. Progesterone and estrogen, we do utilize capsules for the absorption, because you get good blood levels with that. But there's different forms. Like you could do pellets, which we do not do here because we like that consistency and that level. So we know and we can treat that individual on symptoms they're having, and then just adjust the one medication. And that's a procedure. So people have to do that on a routine basis.
Yeah. I know that when I came in, my doctor was like, or I'd asked her, do I really need to be on my hormone patch? Because I thought, is this something I can handle the sweats, I can do whatever. And this was about 8 years ago. And she was just like, nope, there's no reason why you really need to be on it. You don't have to be on it. And then I come and see you and you're like, oh my gosh, you know what this helps, in
Yeah.
your body. And I thought, well, why didn't my doctor tell me the benefits of being on it? So that, I felt like I lost 8 years of really feeling like I should.
Yeah, I feel like a lot of people get that, unfortunately, because they say it's a normal process of aging.
Mm-hmm.
But do you have to feel that bad and not have a good quality of life? We have come a long way with medicine, and they'd be fine. And a lot of people are fine. Like, let's add this medication, let's add an antidepressant, let's add fish oil, like, let's add these different things. But whenever we could just fix the root cause, and like you said, you were working out really hard, you were trying, and that's what I get with a lot of people, or I get some people that are like, I just can't even get up and function anymore.
Mm-hmm.
Or you get marriages that are falling apart because people are super moody. They have no libido. So what is that doing good for people? I think conventional medicine is just they react to what condition you're having now versus like treating the patient and helping prevent long-term health
Right.
issues.
Right. And I think sometimes we don't know how we feel until we feel really good.
Yeah.
And then you're like, man, I really wasn't feeling like I should. I feel really good now, and
So
so
that's,
that's
yeah, so that's tough. So how does someone know common symptoms of I'm sleepy because I have a busy work schedule and the kids versus it really being a hormone imbalance that like people overlook? So what are some symptoms? Because like you use the word moody. So I think when people
Mhm.
think hormones, it's, that certain time of the month with women or teenagers, just extra hormonal. So when do you know when it's an imbalance and to get it looked at to feel better? Like Jenny said, if you don't know, you don't feel good.
Yeah.
That
For
makes
one,
sense.
I never think it's bad to look at hormones, so that whenever you do have a true issue hormonally, you can look back at the decline. Like I have many patients that have like slowly started having some symptoms of hormone dysfunction and they've been trending it over the years. But honestly, like a combination of like, yes, if your kids are waking up constantly, is that hormonal? Not necessarily. Like fix the underlying cause. If the kid wasn't waking up, you slept really well, do you feel better? Not necessarily hormone, but definitely like poor sleep. Women like in perimenopause, they could tell me like, I've been a good sleeper my whole life, and then all of a sudden I can't sleep. I'm having hot
Oh, okay.
flashes where they just can't sleep. They're really anxious. Some people don't know, like they're just like, all of a sudden I just feel depressed, like I have no motivation, I have no drive to do anything in these things I used to enjoy. Well, if you don't have an underlying mental health issue, that's not a common thing. Something is abnormal, um unless you had like a super stressful life event. But I mean, I would say like definitely like brain fog. If you've never had any mental like brain fog, like you can't function in your job now, you're having poor concentration, definitely can be like a hormonal imbalance. Like I said, the poor sleep, just yes, in women that are still younger and you're having those menstrual cycles, that is you can get that PMDD, which is cause of that like hormonal change prior to your menstrual cycle. So they will be like super moody. They will have like um, insomnia, they'll have binge eating, anxiety. So that's linked, they would know specifically because they're having that prior to their menstrual cycle. But other like issues that people come in with, their hair's falling out, it's getting really brittle. Of course, the traditional that everyone thinks about is like low libido, erection issues. But women will have like vaginal dryness. They'll have vaginal atrophy, the hot flashes. You can have headaches prior to your menstrual cycles. That's a common issue that's showing some like dysfunction there in the hormone balance. So it's a array of symptoms. So I never think it's a bad thing. Like, you're never going to be wrong if you're like, hey, I just want to see, is this related to hormones, or could it be completely something else? And that's fine. Like, I have people that happens to, and you know what? We just address it in a different way. We go a different route. It doesn't always have to be hormones.
Right. Right. And I think that it's important to note that men can have the feeling of just not feeling like themselves. They don't have to have all the other symptoms. They can just like women not feeling right or off a little bit. That, that was Chris's thing. He just said, Jenny, something is not right. I just don't feel right. And that's what prompts him to go and get his hormones looked at, because but I just wanted to make note that men cannot feel right, and it can be a hormone issue as well.
Absolutely. I mean, and I always know, like, you don't have to have every symptom. Like, you could just have one or two of those symptoms. But men typically, yeah, they get very depressed. Those are more common to be on antidepressants later. And that's a good thing, that you need to just go ahead and look at their testosterone. It's not, a lot of men think like, oh, my testosterone's not low because I'm not having erection issues. That's not always the case. Yes, sometimes, a lot of the time, but not always. Like, I'll ask people and they're not having erection issues. They're just having all the other symptoms, or they're just like, I nap all day long. Like, I sleep all night, I nap all day long. Like, I just go to work and I'm just doing the basic I can do. Definitely just knowing, just little symptoms. And like I said, getting those hormones checked can be important. So you could find an underlying cause.
Right.
So you had kind of touched on this, Jessica. So could someone go to their general family practitioner and say, check my hormones? Do doctors not like to talk about hormones, or do they just not understand it? Why would someone need to go to somewhere like Optimize You over maybe just their general practitioner? What's been your experience with that?
I do feel like my patients, by the time they get to me, have been pretty frustrated because they've been asking. And unfortunately, like, insurance-based world, that they have to hit so many guidelines or your insurance isn't going to pay for it. And then it can be extremely, like, through insurance way, it can be really expensive to get those hormone tests. And yeah, I agree. Some providers just don't know about it, and that's fine. Because again, it's not something you learn in school about. We go into hormone optimization and we know, okay, that is extra, like, training that you need to go into and like learn specifically about all of that. So I don't think it's bad if a provider says that, but having a resource that you could go to. But I will say, a lot of my patients, by the time they get to me, have been fed up. They're like, I've asked and I've asked, or they're in the very low range of normal and they're having every symptom of hormone dysfunction. And they're like, well, your labs are normal. I can't do anything for you. Let me give you this medication.
Right. So along with that, you said something about insurance. Optimize You is not, you don't go through insurance whenever you come into Optimize You. Correct?
Yeah. And that's why, because I don't want an insurance company telling me how I got therapy.
Right.
I'm treating you. Okay. I am treating you and I'm making you feel better. And I don't want to have someone tell me, well, that got declined because they're not having this, this, and this with it. Okay.
Right.
And I will find a lot of patients that did go through insurance. They're like, you're equivalent to what we would be paying out of pocket with our insurance too. So we do try to be mindful of cost. Okay. Lab work, medications, they are expensive. And so we don't like gouge in that way. We do try to make it so we can help as many people, but also I don't want someone telling me how to treat you because you didn't hit this, this, and this box. And then, did you know testosterone's off label for females? Okay. So insurance isn't going to pay for that, but we need testosterone. So again, I think it's at this point right now where we're at, that's how we have to go about it, because we, looking at other clinics that have tried it in the past, it didn't work. It got declined a lot. And so, again, we just want to treat the patient the best that we can possibly treat the patient.
Did you say testosterone's off-label for females? Is that the word you used?
Yeah.
Okay. So that means like, what was that? Sorry, explain that again. So what's that mean?
So they haven't approved that for use in females. They don't see that it's a vital use for females.
Okay. Yeah. Do females have natural testosterone, right? Like you will find some testosterone. Yeah. Okay. I just wanted to make sure I was clear on thinking that we have some already, right?
Yes, exactly. Okay. We have it. We need it.
Just making sure I was on the same page with everyone.
Right. That's the crazy part. Absolutely.
Okay.
And so that is the frustrating part with where we're at, unfortunately, with the hormone world. And that's why you find a lot of clinics that are a concierge business, because we don't want them telling you what to do or denying it. And you'll get some providers that will do it, but again, your insurance will not pay for it at all.
Yeah. Yeah. And I'll be honest, I actually asked my doctor, I just said, if there was ever a time that I would want you to prescribe my estrogen, could you do that? And she said, well, you better continue doing what you're doing, because we can only prescribe a certain amount. And so you know, she knew that it was probably better that I was at Optimize You rather than her trying to prescribe what the book said I needed.
Yeah. Again, and we're not like we're not just going out there and prescribing. Like, we trend our patients' labs. We actually see our patients in lab work more often than a primary care would. Okay.
Absolutely.
So when people come in first, of course, you come in for that initial panel. We go over that in detail with you, go over your symptoms. We start therapy. You come back in that 5 to 6 week window for lab work again. We talk again. If we need adjustments, you could come back sooner. But all of our patients are getting labs every 3 months. Okay. So I'm seeing their hormone levels. I'm seeing their kidney function, their liver function. We're seeing all this every 3 months. So I see my patients and talk to my patients significantly more than what a primary care would. And we're doing more testing on them than that. So again, it's not like I'm going out there and prescribing these crazy doses that patients wouldn't need or not following up with it. I'm keeping them in those ranges that clinically, following the research, that it is where it's improving organ production. It's doing internal benefits for the patient for long-term health, along with getting rid of symptom. And so the patients feel better. Now, is that with every clinic? I can't speak on every clinic, but that is how Optimize You, our standards, and where we like to be with our patients, so that our patients are comfortable and treating them the best way possible.
So once you get a client at kind of like their base level, they're feeling better, they've seen an increase in how they feel, you've seen an increase in the labs, do they need to stay on those hormones forever? Is that something their body catches up with, or are they always going to need to be on those level of doses to stay or increase how they're feeling?
You stay on those doses. You have to think. So in menopause, we lose our ovarian function. It's not coming back. So if you want to feel good and you continue, that there's no age that you have to stop it at, unless you just chose like, I'm ready to stop hormones. But no, I have 80-year-olds plus on hormones and they're feeling great. They're thriving. They're working out. They're enjoying life. So no, there's no sense in stopping it. But just the way that like females, we know we go through menopause. You know, men lose that. They're not getting it back. Now, if it's a younger person and we're making lifestyle adjustments, like they came into me, they're not exercising, they have poor eating habits, they're not sleeping, then definitely we're going to work at lifestyle changes to help that. Could they get better ovarian function or testicular function? Absolutely. We can do lifestyle changes and we should for them. But no, once, you know, we hit a certain age in our life, you're going to be on it. And that's what I tell people. Like, if you want to continue on, like you're feeling better, you're having symptom relief, then you'll stay on it until you choose to come off of it.
Right.
Interesting. Is that this, probably totally off subject, like people who struggle with reproducing, could that be an option for them to look at, is to do like hormone testing and see if there's something that needs to rise to like increase sperm production? Or is that like a totally different biological thing?
No,
Because you hear
absolutely.
people say we struggled reproducing, so we went and got tests, but I'm curious if they're going to a doctor saying, oh, we're not seeing anything, versus maybe going a step further and looking at maybe like hormones and stuff.
Yeah, I mean, absolutely, you can do that, and you
Is
should.
that-
Like, if reproductively you're having some issue, there's an imbalance in something. Yes, in
Yeah.
men, they'll definitely do like sperm tests, but typically you would
Yeah.
start with like hormones to make sure, like, specifically, is a female ovulating? Are their levels at an appropriate range? Also, progesterone. If women don't hold progesterone, you can't hold that pregnancy. Okay.
I guess so.
So
Like
you
when
have
people
to,
go through shots, is that what they're injecting themselves with? Or like hormone shots, I guess, to help with reproduction?
like an IVF and things like that.
Yeah, that's what I couldn't
You
think
can
of.
go
Yeah.
through like a specific provider. They would continue, not always. There's different forms of things, like there's oral injectables, and then if they need progesterone to hold pregnancy, there's different forms that they can do in that time. But like if you're working with a fertility clinic to do that, they typically, I would say, would be testing your hormone
Should be
levels.
checking the hormone stuff. Okay.
Yeah.
Interesting. You had just mentioned that for like depression and things like that. And I was just curious if that was another area in people's lives to open up and consider as well. But a fertility clinic should be more knowledgeable in hormones than
Should. I mean, I don't know.
that.
I've never worked in a fertility clinic, so I can't like speak on everyone. But yes, I definitely, they like check sperm counts, and like they do different procedures and hormone testing for.
You mentioned testicular function, and it just made me think of, for some reason.
Yeah. But definitely, I mean, you have to think like in the form of like even progesterone and pregnancy. Like, women battle with postpartum depression. Okay. So
Yeah.
that's like that rapid drop in our progesterone levels. You could taper a female off of progesterone instead of putting them on antidepressants. Like that's a form that you can do for postpartum depression. That's how vital it is that, again, if you're having symptoms like this, like hormonally, you should get checked out. It's never going to hurt just to see. There's a lot of things that these, like, we can do that we're not putting you on other medications that could be fixed by helping your hormones. Again, with bioidentical, not synthetic of any kind.
And is that the big difference between someone saying like, oh, I don't want to go because I don't want to be put on medicine? Hormones are things that your body should naturally be producing. They're just imbalanced. So you're not getting put on medication. That's what you mean, like the difference between synthetic and like the natural hormones. Our body produces these. It's just they're imbalanced, versus an antidepressant is a medication that we don't usually produce to help with those results, right?
Yeah.
Like if I'm somebody who says, I don't want to be put on medicine, I'm not going to come to hormone therapy because they're just going to put me on medicine. That's not, that's very different from medication.
Yeah, because yes, again, I think you put it very well. Like it is an imbalance in what you do. And yes, it is in the form of a capsule and like an injection, but it is mimicking your body's own natural production of that to better help you with symptoms you're having.
What other like lifestyle, diet changes, things like that, will help in somebody's journey that they're having with this hormone imbalance, or what do you advise people to do? I guess it depends on their goals, but is there any advice you have in regards to that?
Yeah, I mean, I always tell people like a whole foods diet, you can't go wrong with that. Like you're actually eating real food, not overly processed, fried foods all the time, high sugar, because those are greatly going to impact hormones, but also just general health. It's a true crisis in America that people are overweight and that we're overly eating like processed foods constantly, extremely high sugar. Just again, eating like a good balance of your fruit, vegetables, meats. Like, I don't think anyone has to be on a certain diet necessarily, as long as you're just eating a good balance of like just actual food.
Right.
But that does impact, like if people are severely overweight, they're having a lot of processed high sugar foods, in the instance of like polycystic ovarian syndrome in women that a lot of women deal with that can cause infertility. You can make great impact with like how they're exercising and how their diet is and like their glucose regulation, insulin control, and you can help their ovarian function that way. And you don't have to necessarily put them on medication. There are medications that help it, but you don't always have to do just the standard, like, let's put them on birth control, metformin. You can do other routes. And you should be teaching them how to understand how their body responds to food and what they can do to heal naturally and keep their inflammation down.
Yeah, I was diagnosed with metformin. This was a while ago and I'm no longer currently on it, but I never really understood why. They said it was like for pre-diabetes. And that's just really interesting hearing you say that. I wonder what probably, I guess, the other cause was for needing to
I
be
always
on
tell
that.
people, I don't love the term pre-diabetic. Why don't you just say you're diabetic? If you're having high blood sugars, you're having bad glucose control, you're getting to the form that you're diabetic. Okay. Let's make changes diet-wise that could be affecting that. Type 2 diabetes is preventable. Okay. There's lifestyle changes that you can do that will help you change that level and where your insulin levels are going. But again, did they go over diet with you? Did they go over any of your lifestyle with you? Or did they just
Well,
say,
no, because no one said anything like, oh, because my general practitioner diagnosed it. And then I go to my OB for just my yearly checkup. She's like, why are you on this? Like, you're not over. She looked at my weight. Like, she's like, you're not overweight. Like, she didn't understand why. And I think if I remember, it's like, if they wanted you at 14, I was at like 14.5. Like, I knew it was like really minimally a difference, but I never really knew what to ask to say. I was much younger. Why do I need this? What is it for? What is it going to help me with? When do I get off of it? I just realized I didn't and just stopped it. But it's just kind of sad that so many people put a lot of trust in listening to what someone tells them they need to do instead of, like you said, you guys really work with the client and how are they feeling, not just numbers on a paper saying you're in range or out of range.
Yeah, it is really sad, honestly, that because you're not always, I think it's hard because like I've been in healthcare for a while, so I am an advocate, but you know what? I go with my family to the doctor's appointments because they've been in that scenario too, that if they didn't know, they'd be like, oh yeah, I'm going to do that until someone questions. And then that's when you get answers, which is very sad. That's why we give that longer period of like, I sit down, I give an hour for my appointment. Sometimes I go over because I get a little talk too much sometimes, but I also tell you why. Okay. Do I not go through every lab? And I'm like, this is what we're looking at. This is why. This is what we can do to help fix this. I do want my patients working out and I do want them eating healthy. I'm not easy on you. Okay. I can't do everything. Okay. You have to put in the work outside of being with me. I will give you it all. I will tell you everything I can tell you to help you. But if you're not doing it outside of this, nothing will help you. Nothing's a magic cure. Like you have to have a balance of you can fix someone's hormones. You have to have a whole food diet, like low processed, and then you have to have physical exercise. A sedentary lifestyle will kill everybody. Okay. Skinny, fat, sedentary lifestyle will kill everyone. And that's what we're doing all the time. We're at our jobs half of the day and most of us are sitting down. Okay. That greatly impacts your resting metabolic rate and how efficiently you use food, creating type 2 diabetes. And then I always tell people diabetes will kill every organ in your body. It literally constricts everything up. You're not getting that good blood flow to anything. So it is very vital that people know that. And I do want you to be an advocate for your own care. In the instance, like someone went to put you on something, I'm going to tell you why I'm putting you on something. Okay. I want you to participate. I want you to be comfortable with your plan of care. If not, well, then we need to make you comfortable because you're not going to be compliant with it if not. And that's not how it should. You make your own decisions in healthcare. No one else does.
Right.
That's such a big thing. And like I said, from personal experience and then going with family members to doctor's appointments when they were going through stuff, there are wonderful medical professionals out there, just like in every profession.
Absolutely.
The lack of people asking questions just to understand and not just taking what they're saying and going with it. And when someone else asks you, well, what are you doing this for? Well, I don't know. My doctor told me to. That's a lot of power in someone's hands who has no idea how you are feeling.
Well, I think Megan, most people want an easy button. They're like, okay, this pill is going to cure my pain, or this pill is going to cure this or make me feel better. But when they hear that they actually have to do a little work or change, eating the Cheetos on the couch or whatever that is, like that's hard. That's hard, but taking a pill is easy. And so, I think some people just don't want to ask questions because they don't want to hear what the real answer is.
I agree with that. I mean, it is. And there's wonderful healthcare providers. I feel like they truly wanted to help people or they wouldn't have went into that career, honestly,
Yeah.
But also, how much can you teach? Like, how much can you teach a person in a 15-minute appointment, 20-minute appointment? Their hands are tied too. Again, they have that like turnover. How much can you, or you'll be running behind on every single patient.
Well, yeah, I can't imagine the freedom you have to help not being tied down by insurance.
Yeah. And so, like, again, we make our appointment times because I do want to give that time to people. And that's not realistic for every healthcare group. And I understand that. And so I think people taking charge of their own care, it is a difference. I do have very motivated patients. Again, by the time they've come to me, a lot of people are like crying in consults with me because they're just so frustrated with everything that they've been to. And that's sad. It really is sad. And I agree. Some people are just like, I'm having a symptom, give me that, and I'm gone. And that's totally fine. If that's what they want, that's what they want.
But there's some people who probably desperately want to be off of antidepressants and postpartum. That is something that now I am a depressed person when it's really so much more going on with your body. So do you see a lot of people getting to get off of like those medications, the antidepressants, the anti-anxiety, getting off of kind of weight? Those people want to feel better too, I'm sure. So if they're being proactive with the other things you said, lifestyle, eating right, do you see where you can get a hormone balance in place where they're no longer having to be on like antidepressants and stuff like that?
Oh, absolutely. I would say majority of my patients are very, very motivated, that they want to come off as much as possible, that they don't want to be on medications. And if that's their goal, then we work at that and working with like primary care and things like that, to get them into healthy zones. Like we're going to be testing things and working on certain things before you would just like cold turkey, like stop anything.
Yeah,
because you do need to
for
safely be titrated off of things before you're just like, nope, I'm done. Especially if you've been on them for a while. And so I think it's just working with providers that are willing to do that. And if that's their goal too. And if I have a patient motivated like that, absolutely, we will do everything we can to try to decrease the amount of medications they're on.
What is we've talked about, I think most of the time, people come in when they're low. What's the risk or what are some of the side effects people might have of having a high hormone levels? Like, you put them on something and maybe they call you back and say, something's not right. And like, what are those symptoms usually?
I would say I always start like low and work my way up. So I don't traditionally I wouldn't be like, oh, they're excessively high on stuff, but you can have a dominance in certain hormones for sure. So you have to think like testosterone, you're thinking more like unwanted facial hair. You can have hair thinning in certain spots. You can have a lot of acne, deepening of the voice, you can have with like estrogen, women can have excessively like heavy bleeds, breast tenderness, moodiness. Like there's a different, like, again, if there's an imbalance of anything, you're excessively high or low on things, you have those symptoms too. The mood changes prior to menstrual cycles. Men typically, yes, like if you were having like excessively high levels of things, like if they're having like too high of testosterone, they could have like blood pressure issues. Like you can have higher than normal blood pressure. But
Oh, yeah, I
again,
didn't even
keeping a
think about that being too much
level.
testosterone. That's
What?
interesting. I didn't even think about that. Too much testosterone as a result of high blood pressure. That's interesting.
Well, if they're abusing it in a way, okay.
So, like, their body wouldn't produce too much of it. They would have to be consuming an additional amount.
Mhm.
Okay,
Yeah.
well, Jenny,
For
when Jenny
men,
said everything's too high, can your body produce too much of it and you guys have to bring it
yes,
down, or is it too high because someone's
just
putting it
like,
extra in there?
yeah. Women, like PCOS women, are typically like more estrogen or testosterone dominant. They're going to have like an imbalance in their progesterone levels. So those women will have, like, again, that facial hair, the unwanted acne. You'll have those symptoms, and their body's producing that through what they have going on internally. Men typically, there's an underlying cause, like have we been taking extra of something that has increased that higher than normal? It's just, you have to look at everything all together, and that's why you do a combination of different things to further assess, like, what's the culprit of this imbalance of hormones. But I would say women still, a lot of women come in with that too, of like the abnormal menstrual cycles. That's, again, they can be high and low on things. You don't always have to be low. There can definitely be one that's overbearing the others, and we have to work at making lifestyle changes to help that.
Right. So how long would it take for someone to see changes once they start this hormone therapy? How quickly or delayed do results start happening?
So, like in the consensus of males, they typically by week 3 have been telling me like they notice a difference. By week 6, when they're coming in for labs, they can realistically tell me like, this is improved, this hasn't improved, and then kind of titrating and adjusting from there. The longer you've ultimately been on hormones, the better for like the internal things that have happened, the longer you've been on them. But realistically, like even like with women, I have you come back in 5 weeks, they should be able to tell me like, again, this is improved, this hasn't improved, I've noticed some adjustments, we're seeing the labs slightly come up, but maybe not to that optimal range where they're feeling complete symptom relief. Because again, starting them lower and working our way up to adjust them into that.
So Optimize You offers a lot of things. The hormone therapy is a big piece of it. But what else is somebody, I guess maybe if somebody wanted to get started doing this, what do they do? Okay, what's the first thing they do? And also, what else do you guys have there for your clients?
Yeah. So to get started, you don't have to have like any type of referral. Patients will typically just come in for like the initial lab work, which covers your hormone. And then I do have like add-on labs out there if people are interested in like vitamin levels, further testing in specific areas for conditions. And this front desk staff is really great. They can help you determine, or they'll come and ask us specific if you're questioning like add-on labs. If not, typically the add-on labs are once we've sat down with you and like further assessed, then we'll be like, okay, well, maybe we need to get this, and this. But the initial lab work gets covered. And then once you come in for that, the staff will schedule you for a consult with myself or Derek. We're both the providers here and owners of the clinic in Evansville. And then we'll sit down with you. We'll have that consult of going in depth about your labs, your symptoms, to develop the treatment plan. That's like getting like the hormone Even a lot of people with weight loss goals will look at that because, again, is it another issue that is causing that weight loss? Or is it just like a lack of exercise, diet combination there? We have recovery services. So on top of fixing internal, we like to make sure that people have the option for, like, we have cryotherapy, we have cold plunge, we have infrared sauna, we have the float deprivation tank, we have compression therapy. So those can be really beneficial, and a lot of patients utilize those to progress their recovery, and so keeping their inflammation down. And then the benefits of like cold and hot therapy for like cardiovascular benefits. They will do a combination of those. We have IV therapy with vitamin infusions. And so we have different ones available. We always ask you symptoms, and we can do genetic testing that can give you specific like IV precision that you would need with the exact amounts. We have PRP joint injections. So we take your plasma out. Well, we take your blood out, spin it down, take the plasma from that and re-inject it into the site to stimulate growth factors at that joint to better assist with like joint pain. We do have peptide therapy. So there's different variety of peptide therapy. So again, depending on your symptoms and goals, we have some for like joint pain, inflammation in the gut. We have the weight loss peptides. We have ones that help with like like stimulating your pituitary to make human growth. So they're helping with like lean muscle mass, recovery. It can help with like fatigue, better sleep, cognition benefits. Feel like we have a lot to offer.
You have a lot of stuff.
A lot of stuff.
Yeah.
That's amazing.
We do.
Well, we're going to go ahead and wrap this up. But thank you so much, Jessica, for coming on our podcast. Like I said, I am a raving fan. I tell everybody about my experience, and so glad you're here. And if there's anything that we can do for you in the future, you make sure to reach out and let us know.
Awesome. Well, thank you so much for listening today. Be sure to follow us and subscribe wherever you get your podcasts. Stay connected with us on social media, and we want to hear from you. So let us know what you learned from today's episode. Use the hashtag KickItUpANotchPodcast. And until next time, let's keep working together to kick it up a notch in everything that we do. Thanks for tuning in to Kick It Up a Notch. If you enjoyed today's episode, don't forget to subscribe, leave a review, and share it with your friends. Until next time, keep reaching higher and kicking it up a notch.